Imagine waking up every morning feeling sluggish, dragging yourself out of bed only to face another day of constant fatigue, interrupted sleep from endless bathroom trips, and nagging worries about your prostate health. If you're a man over 60, this scenario might hit too close to home. But what if the solution to reclaiming your vitality was as simple and accessible as the water flowing from your tap? Dehydration sneaks up silently, exacerbating prostate issues like benign prostatic hyperplasia, BPH, and sapping your energy reserves. Yet, by prioritizing proper hydration, you could flush away irritants, reduce inflammation, and unlock a surge of energy that makes you feel years younger. In this comprehensive guide, we'll uncover the science-backed connections, warning signs, practical tips, and long-term benefits that could transform your daily life. Whether you're battling frequent urination or just feeling run down, staying hydrated isn't just good advice. It's a game changer for men's health in your golden years. As men age, the prostate gland naturally enlarges, leading to conditions like BPH that affect over 50% of men in their 60s, and up to 90% by age 85. This enlargement can compress the urethra, causing weak urine flow, urgency, and nocturia, those disruptive nighttime bathroom visits that rob you of restful sleep. But hydration plays a pivotal role here, acting as a natural ally in maintaining urinary tract health. Proper fluid intake dilutes urine, preventing the concentration of minerals and irritants that can inflame the bladder and prostate. Dehydrated urine becomes darker and more acidic, which can irritate the lining of the urinary tract, worsening BPH symptoms such as pain during urination or incomplete bladder emptying. In fact, studies have shown that increasing fluid intake can directly improve lower urinary tract symptoms, LUTs associated with BPH. One notable trial demonstrated that focused hydration over just 8 days enhanced prostate function and alleviated symptoms without any adverse effects, highlighting how even short-term improvements in water consumption can yield noticeable relief. Beyond the prostate, dehydration impacts the entire urinary system. Inadequate water intake increases the risk of urinary tract infections, UTIs, kidney stones, and even chronic kidney disease, all of which can indirectly burden the prostate by promoting inflammation or blockages. For older men whose kidneys become less efficient at conserving water, this creates a vicious cycle. Dehydration concentrates urine, leading to crystal formation that can obstruct flow and exacerbate BPH. Research also links proper hydration to hormonal balance, as water helps regulate testosterone levels and reduces oxidative stress on prostate cells, potentially lowering the risk of more serious issues like prostate cancer. Hydration supports detoxification by flushing out toxins and waste products that might otherwise accumulate and contribute to chronic inflammation. But the benefits extend far beyond the prostate. Hydration is intrinsically tied to your overall energy levels. When you're dehydrated, blood volume decreases, forcing your heart to work harder to circulate oxygen and nutrients. This impairs cellular function, leading to fatigue, reduced cognitive sharpness, and diminished physical performance. In seniors, where body water reserves naturally decline, older adults have about 50 to 60% body water compared to 60 to 70% in younger people. Even mild dehydration can cause significant energy dips. Many men mistakenly attribute this tiredness to aging, but correcting hydration can restore vitality by optimizing circulation, supporting muscle function, and enhancing brain performance. Contrary to the myth that drinking less water reduces bathroom trips, restricting fluids often worsens long-term prostate health by allowing irritants to build up. Instead, consistent hydration promotes smoother urinary flow, fewer interruptions, and sustained energy throughout the day. Hydration in seniors is alarmingly common and often underdiagnosed, affecting up to 20 to 30% of older adults due to diminished thirst mechanisms, medication side effects, and reduced kidney function. Unlike younger people, seniors may not feel thirsty until dehydration is already advanced, making early recognition crucial. One of the most telltale signs is dark-colored urine, nothing deeper than pale yellow. Indicates concentrated waste that is straining your kidneys and irritating the prostate. Reduced urination frequency, such as going less than 4 to 7 times a day, is another red flag, as it suggests your body is conserving fluids at the expense of flushing toxins. Fatigue and unexplained tiredness are hallmark symptoms often mistaken for normal aging. Dehydration reduces blood volume, leading to inefficient oxygen delivery to muscles and the brain, resulting in weakness, lethargy, and even muscle cramps from electrolyte imbalances. Dizziness or lightheadedness, particularly upon standing orthostatic hypotension, occurs because low fluid levels drop blood pressure, increasing fall risks in the elderly. Physical cues like a dry, sticky mouth, cracked lips, sunken eyes, or skin that doesn't snap back when pinched, poor skin turgor, are visible indicators that demand immediate attention. Headaches from slight brain shrinkage due to fluid loss, constipation from slow digestion, and even confusion or irritability can signal dehydration, mimicking cognitive decline or mood disorders. In severe cases, rapid heartbeat, nausea, or blurred vision emerge, potentially leading to hospitalizations if ignored. These symptoms don't just stand alone, they amplify prostate issues. Concentrated urine irritates the bladder, heightening urgency and discomfort in BPH patients, while energy-sapping fatigue makes daily activities feel overwhelming. Factors like diuretics, hot weather, illnesses, or even forgetting to drink due to mobility issues exacerbate risks. Seniors on medications for blood pressure or heart conditions are particularly vulnerable, as these can increase fluid loss. Monitoring is key. Track urine color, energy levels, and symptoms daily. If you notice fewer tears when emotional or persistent weakness, rehydrate promptly and consult a professional to rule out underlying conditions. Achieving optimal hydration starts with knowing your targets and building sustainable habits. For prostate health, timing matters. Prioritize morning and afternoon drinks, tapering off after 6 p.m. to minimize nocturia. Incorporate hydrating foods, which provide about 20% of daily fluids. Opt for watermelon, 92% water, cucumbers, oranges, or soups to boost intake effortlessly, while adding nutrients like vitamin C that combat inflammation. Track progress. With apps like Waterminder or a simple journal, noting intake alongside symptoms to fine-tune your routine. If you have kidney or heart conditions, get doctor-approved adjustments to avoid overhydration risks. Steer clear of dehydrating culprits. Caffeine, alcohol, and salty foods draw water from your body, worsening prostate irritation. Swap coffee for herbal teas or infused water with lemon for flavor and added antioxidants. In warmer climates or during exercise, add 1 to 2 extra cups to offset sweat loss, ensuring urine remains pale. Kickstart your day with a glass of water upon waking to rehydrate after overnight fasting and promote prostate flushing. If BPH makes you hesitant about fluids, remember that moderate, consistent intake actually eases symptoms over time by diluting urine and reducing inflammation. For energy boosts, this routine prevents afternoon slumps by maintaining blood flow and nutrient delivery. Build habits gradually, set hourly reminders, use marked bottles for visual cues, and pair drinks with meals, a glass, before, during, and after. If plain water feels bland, experiment with infusions, like mint or berries. But avoid sugary alternatives that could spike blood sugar and indirectly affect hormone balance. Making hydration enjoyable ensures long-term adherence, especially for seniors facing barriers like forgetfulness or mobility challenges. Infuse water with fresh fruits such as berries, citrus, or herbs for natural flavor without added calories, turning a chore into a treat. Keep water accessible. Place colorful, easy-grip bottles in key spots around your home, like the kitchen, living room, or bedside, to serve as constant reminders. Habit stack by linking drinks to daily routines, while taking medications, watching TV, or during meal breaks for seamless integration. Embrace watery foods in creative ways. Blend smoothies with spinach and strawberries. Enjoy vegetable soups or snack on hydrating fruits like grapes or peaches to diversify intake. Socialize your efforts. Schedule hydration breaks with family or friends over herbal tea. Fostering accountability and enjoyment. Leverage technology with apps that send reminders or smart cups that light up when it's time to drink. Minimize obstacles by limiting caffeine and sodas, opting instead for electrolyte-enhanced waters if you're active or in hot weather. The long-term rewards of consistent hydration are profound, particularly for prostate health and energy in older men. By flushing irritants and maintaining dilute urine, it slows BPH progression, reduces urinary urgency, and lowers infection risks, leading to fewer disruptions and better quality of life. Studies indicate that adequate fluid intake supports prostate tissue integrity, potentially decreasing inflammation linked to cancer and improving hormonal regulation for sustained vitality. Energy-wise, hydration optimizes brain function, enhances physical endurance, and combats fatigue, allowing for more active, engaged years. Additional perks include improved joint lubrication, better digestion, stabilized mood, and even weight management, as water curbs appetite and boosts metabolism. Men who prioritize hydration often report revitalized sleep patterns without nocturia, sharper cognition, and reduced reliance on medications for symptoms. Over time, this simple habit compounds into heart health benefits, lower oxidative stress, and overall longevity. Research shows enhanced lower urinary function with sustained intake, proving it's an investment in your future self. Start small, 1 extra glass today, and watch as easier urination, boundless energy, and prostate peace become your new normal. Do not let dehydration dim your golden years embrace. Hydration as your secret weapon for prostate prowess and unstoppable energy. If you're over 60, pledge to add that extra sip right now and track how it transforms your symptoms. Your body craves this simple upgrade, rewarding you with smoother flows, deeper sleeps, and vibrant days ahead. Share your favorite hydration hack in the comments below and encourage a friend to join the journey. Stay hydrated, stay strong. Your best years are still unfolding.